Good afternoon. Is it a good afternoon? That was like, let's try that again. Good afternoon. All right, great. So we are here this afternoon to go through and celebrate a time-honored tradition of welcoming our dental students into the profession. And it is traditional and customary for us to down you with the white coat that symbolizes all the things that we think are important, the ethics of our profession, and it is a significant step. In many instances, we do this as students progress into clinic, but in some schools like ours, we do this as you progress into the profession. And so it is a way of shining upon you the things that we think are important, and to put that responsibility that you now have to carry right up front as you're starting school. And so this is a very important and very big symbolic occasion. I'm so glad that your family and friends who've come to witness this and celebrate it. And so I just want to welcome everybody for being here this afternoon. At this time, we want to recognize the class of 1961 for the generous support of today's event. They are sponsoring it, and we're so grateful for that support. At this time, it is my honor to introduce Dr. Gary Anderson, Interim Dean of the School of Dentistry. Dr. Anderson is an associate professor and tenured faculty member in the Department of Developmental and Surgical Sciences, Division of Pediatric Dentistry, and has held multiple positions in his 30-year tenure at the School of Dentistry, including serving as Senior Associate Dean from 2001 to 2007, Department Chair on 2 separate occasions, and Program Director of the Cleft Palate Clinic and Craniofacial Anomalies. Please welcome Dr. Anderson.
Thank you, and welcome all to the University of Minnesota campus on this great occasion. I'd like to thank the students for being here, of course, their families, faculty, and honored guests in attendance. It is my pleasure to welcome you to this white coat ceremony. It's an important milestone in your journey. It's a symbolic rite of passage signifying your entry into the oral health professions by donning the white coat. So why a white coat? What is its significance? It's the garb of the scientist, obviously. Those of you who have worked in labs may have worn white coats. It's also the garb of the learned health professional. What you do throughout your career is derived from the world of science, and you've chosen a health profession, one that seeks, through science, to improve our lives through the treatment and eventual elimination of disease. Thinking about this in a little bit more concrete way as students. When you started your first day of school in kindergarten, a long, long time ago, your tasks were pretty simple, and you had to only focus on yourself. You had to remember to raise your hand, to not talk when somebody else was speaking. You had to remember to lay down and where to find your roll when you were going to take your nap. And whenever you walked someplace, you had to walk 2 by 2 holding hands with the next person, and you hoped it wasn't somebody of the opposite gender because you'd get some kind of germs. As you move through your career, you've had times where you were working with fellow students, perhaps in some sort of collaborative project, so you did have to pay attention to another person a little bit. You had to pay a little more attention to the teacher or faculty who were teaching the course, but pretty much right up to the day that you got in here, you mostly focused on your own advancement, learning the things you needed to do to get where you wanted to go. And maybe sometimes, and we hope a lot, because you're actually interested in what was being taught. What is going to be different very shortly is why you're wearing the white coat. And that's that there's a third person who's going to fit in this beyond your teacher, and that will be the patient. And you've never, ever dealt with anything like this before. There's the fear of doing something for the first time on another human being. There's working through and counseling them on choices that they're going to make. It's a very difficult transition, and one that will involve as much effort on your part as any technical procedure that you learn. There's a mantra that we use, and it's not just used in actual one-on-one patient care, but we even think about it in public health policy questions and even in education, and that's when a patient is involved, the patient comes first. You've never had to think about anything like that. I'd love to say that thinking of that, the patient comes first, makes all those decisions and complicated things that are ahead of you easy to answer, and it doesn't, and you'll learn that. But it's certainly a guidepost that many times when I've been in rather difficult conversations, coming back to that makes the path much clearer. So thank you for being our students in this quest to care for others and improve their quality of life. Family members, faculty, staff, and other friends of the School of Dentistry, thank you for being here for this very important event.
Academic, personal, and professional integrity are the cornerstones of success in our profession. At the School of Dentistry, we want this message to come across to our students in a very personal way. We ask every class upon entering the school and beginning their professional careers to create their own code of ethics that is consistent with current university policies and ethical codes of professional organizations. Students work together as a class with no faculty involvement to develop their own interpretation of these codes. The result is a unique class ethical code that is aligned with the values, characteristics, and personalities of each class. During our white coat ceremony today, each student is invited to sign their class code of ethics on the stage to signify in a demonstrable way their commitment to professional ethics. After today's ceremony, these ethical codes for the Masters of Science in Dental Therapy, Bachelor of Science in Dental Hygiene, Doctor of Dental Surgery classes will be publicly displayed in the School of Dentistry. The Masters of Dental Therapy class of 2020 will be the first to present their code of ethics. Please welcome Kylie Anderson to read their class code of ethics.
The Dental Hygiene and Dental Therapy class of 2020 dedicates this code of ethics to our patients, educators, peers, community, and last but not least, ourselves. The intention of this code will serve to remind us as dental professionals of our key ideals for our education and profession. It is our responsibility to internalize and project our promises and behavior through respect, altruism, integrity, compassion, quality of practice, and professionalism. To our patients, we pledge to express professionalism and deliver the highest quality of care while practicing empathy and open-mindedness. We strive to remain impartial, allowing patients to voice their opinions and preferences regarding their oral health. As a class, we promise to see our patients as human beings and not as dental ailments, and to acknowledge that they are seeking our dental expertise to help improve their oral health. We will continue to stay up to date with our dental education and advancements in the field to best serve our oral health community. To our fellow students and colleagues, we promise to implement teamwork, respect, and encouragement in class, lab, and in clinic. As dental therapists, we wish to bridge the gap in the dental field by providing hygiene and restorative dental practices. We acknowledge the various roles for needed proper dental care, and we will work more efficiently and productively as a team to provide a higher level of service and care for our patients. Our collaboration of hygienists, therapists, and dentists will allow us to provide a high standard of comprehensive oral health care and professionalism. As a class, we vow to help provide assistance, counseling, and encouragement to fellow classmates of all degrees. We recognize that with increased cooperation and understanding, we are more valuable as colleagues and healthcare providers. To our community, we vow to increase access to the underserved and rural communities. Our goal will be to spread oral health and hygiene awareness through public health initiatives and educational practices. As members of the healthcare field, we are held to a higher standard of conduct by citizens in our community, both in practice and our daily lives. We will strive to be role models for those both in clinic and in the community by holding ourselves to high standards as oral health professionals.
We will now begin the presentation of white coats, a symbol of professional health care provider. I would like to invite Dr. Carl Self, Director of the Division of Dental Therapy, Dr. Todd Thayer, Associate Dean for Clinical Affairs, and Dr. Gary Anderson, Interim Dean of School of Dentistry, to take their places on stage to present the white coats to the dual degree Masters in Dental Therapy class of 2020. Parents and friends, you are welcome to step forward and take pictures in the front row. We ask you to please hold your applause until the last student in each class has received their coat. Kylie Anderson, Minneapolis, Minnesota. Everett Fulcom, Minneapolis, Minnesota. Amber Irby, Newport News, Virginia. Kelly Kerber, Eden Prairie, Minnesota. Jessica Rivette, Minneapolis, Minnesota. Claire Raisler, Ames, Iowa. Mark Smith, Hawkins, Wisconsin. Annalise Warwick, St. Paul, Minnesota. And now let's give them all a great round of applause.
We'll give just a moment for everybody to have a chance to make it back to their seat, or at least most everybody. Well, welcome here this afternoon. It's a beautiful day outside, and on behalf of the Division of Dental Therapy, I would like to welcome all students here today into the dental profession. But I'd also like to give a special congratulations to our dental therapy class of 2020 as they embark upon their journey to become the newest members of the oral health care team. To the class of 2020, I appreciate your efforts that you put into writing your code of ethics. It was very thoughtful, very collaborative, and your code will guide you well as you embark upon your roles as students, providers, collaborators, educators, and ambassadors. So now I would ask that the dental therapy class of 2020 stand and join me in reciting the Minnesota Oath for dental therapists. And because it's a small number of folks, we really need you to use your outdoor voices. Here we go. In all I hold sacred, I pledge to take this pledge to guide my practice in the profession for which I will be educated. Without discrimination, I will honor my patient's dignity and confidences, and will at all times provide respectful and informed counsel and care. I will recognize my strengths and limitations, and will seek the help and counsel of my colleagues in the practice of dentistry when it is in the best interest of my patients. I commit to being a lifelong scholar, continuously improving and refining the skills I have acquired. I further commit myself to leadership in my community, to advancing access to dental care and to serving all members of society while advancing the practice of dental therapy. The high regard of my profession is born of society's trust in its healthcare practitioners. I will strive to merit that trust. May all my actions reflect positively on myself, the University of Minnesota School of Dentistry, my community, and my chosen profession. Thank you.
Now please welcome Sarah Awad and Anna Vo in the Bachelor of Science in Dental Hygiene class of 2019 to read their class code of ethics.
As part of the dental hygiene community, we are professionals to provide patients with the tools needed to prevent and maintain proper oral health. As dental hygienists, we play a vital role in the prevention of not only cavities, decay, and oral diseases, but also improving patients' overall health. We do this through educating our patients about high-quality oral health care. We not only educate our patients, but ourselves as well. Through our continued education, we are learning about new and advanced ways to provide better care. We also promote high standards of care, and in doing so, we create a safe workplace for ourselves and others. We live in a time where someone's socioeconomic status can be determined by their oral health. It is part of our job to make oral care more accessible and affordable to those that might not have the resources needed to maintain proper oral health. We must treat patients indiscriminately, equally, and on an individual basis. It is our job to offer patients the best treatment and care.
We understand that in entering this profession, we are held to a higher standard. Our patients and the general public trust us, and this trust is based on our actions and behaviors. As a team, we will be there for one another and hold everyone accountable for their actions. We will work together to provide patients with the best treatment. We will encourage each other and be a resource for one another. It is of utmost importance that we treat everyone on the oral health care team and those who visit our clinics with respect. Our code of ethics will be integrated into our everyday actions and behaviors as dental hygienists. This code will be a daily reminder to us to uphold the highest standards of quality patient care. Our code of ethics allows us to be the best possible version we can be for our society and our patients. These will be the beliefs that we will abide by through our careers.
I would like to invite Dr. Christine Blue, Director, Division of Dental Hygiene, as well as Dr. Todd Thayer and Interim Dean Gary Anderson to take their places on stage to present the white coats of Bachelor of Science in Dental Hygiene class of 2019. Again, we ask you to please hold your applause until the last student has received their coat. Anab Adad, St. Paul, Minnesota. Nazmira Amatovic from Columbia Heights, Minnesota. Sarah Awad from Eden Prairie, Minnesota. Inayat Bakalani from Maple Grove, Minnesota. Madison Brown from Forston, Minnesota. Carly Castillo from Minneapolis, Minnesota. Jasmine Cyrus from North Oaks, Minnesota. Kelly Dubois from Minneapolis, Minnesota. Carly Hine from Minneapolis, Minnesota. Rachel Landry from Rogers, Minnesota. Ronnie McCrimmon from St. Paul, Minnesota. Grace Miller from Minneapolis, Minnesota. Michelle Roche from Rochester, Minnesota. Michelle Sevilla Salinas from St. Paul, Minnesota. Caitlin Saponic from North St. Paul, Minnesota. Gabriel Sieper from North St. Paul, Minnesota. Charity Valentine from Hayward, Wisconsin. And Anna Vo from Minneapolis, Minnesota. Let's give them all a big round of applause.
Congratulations to all of you for attaining your goal of becoming a dental hygiene student. Getting here, however, is not what the white coat ceremony is all about. Rather, it symbolizes the beginning of a journey that will last you the rest of your lives. The dental hygiene faculty and I are proud to be your guides as you begin this journey. And our hope is that each of you embrace the responsibilities that align with the symbolism of the white coat and find the same joy in the journey as we have and continue to have each day. Please stand and join me in reciting the oath of the American Dental Hygienists Association. In my practice as a dental hygienist, I affirm my personal and professional commitment to improve the oral health of the public, to advance the art and science of dental hygiene, and to promote high standards of quality care. I pledge to continually to improve my professional knowledge and skills, to render a full measure of service to each patient entrusted to my care, and to uphold the highest standards of professional competence and personal conduct in the interest of the dental hygiene profession and the public it serves. Thank you. Congratulations.
At this time, I would like to introduce Christopher Moss of the Doctor of Dental Surgery class of 2021 to present their class code of ethics.
We, the Doctor of Dental Surgery class of 2021, set firmly the foundation on which our dental education and professional development will flourish by publicly stating the expectations we must embody as future clinicians and professionals in our communities. This philosophy will further unite us and allow us to hold one another accountable, lest we forget the motives that initially drew us to this profession and the values we seek to uphold and advocate for in our lives hereafter. As students, we vow to work diligently, honestly, and with the utmost integrity in order to be the best that we can be. We are honored to be on the stage today and are ready to undertake the challenges ahead of us, both in the classroom and in the community. Issues especially concerning to us are lack of access to care, rising cost of care, systemic disease caused by poor oral health, and a lack of knowledge about the importance of oral health within our communities and throughout the world. While we understand there are no easy answers, we pledge to unite as a student body and work tirelessly in order to find solutions that can help rid the world of these complex concerns. As dentists, we vow to be honest, compassionate leaders for our patients, our teams, and our communities. We recognize that we have not chosen an easy career path. Our patients will come to us in their most vulnerable states when they are in need of help and in fear of pain. We pledge to work as a team under the common goal of treating our patients with exceptional care, both within our clinics and in collaboration with others. We will strive to provide our patients with honest, knowledgeable care while guiding them through their treatment plans. We will be honest with ourselves and with each other about our strengths and limitations in order to create an environment that fosters learning and discovery. We recognize that being a dentist is an incredible privilege and we are all fortunate to be here. We pledge to stay humble and to always carry with us our responsibility to others. It is our moral obligation as future dentists to give back to our community, and we will do so by donating time to those who may otherwise not be able to receive quality dental care. As leaders in the scientific community, we vow to be at the front line of some of the world's largest issues that go beyond dentistry. We will use our knowledge to teach those around us in order to benefit our planet for generations to come. Our class is composed of people from all over the world, and we vow to bring our unique experiences together to positively impact problems that go above and beyond our career as dentists.
I once more invite Dr. Todd Thayer and Dr. Gary Anderson to the stage to present the white coats to the Doctor of Dental Surgery class of 2021. Armita Alzomier, Van, Ontario, Canada, graduated from York University. Israel Emmanuel, Lawrenceville, Georgia, graduated from University of Georgia. Haley Anderson, Eagan, Minnesota, graduated from University of Minnesota, Twin Cities. Peter Clay Bachmeyer, Fargo, North Dakota, graduated from Concordia College, Moorhead. Persia Bakhtiari, Cupertino, California, graduated from University of California, Riverside. Chase Baumgartner, Ramsey, Minnesota, graduated from University of St. Thomas, Minnesota. Audrey Bechtel, Elk River, Minnesota, graduated from University of Minnesota, Morris. Parnia Bahanai, Katy, Texas, graduated from Texas A&M University, College Station. Bethany Blockingen, St. Cloud, Minnesota, graduated from St. Cloud State University. Alex Bolson, Marshall Phil, Wisconsin, graduated from University of Nebraska, Lincoln, for undergraduate and graduate school. Tim Bouquet, Rochester, Minnesota, graduated from University of Kansas. Joanna Borain, Santa Barbara, California, graduated from Wesleyan University and University of London, Goldsmiths. Cassandra Boulard, Winona, Minnesota, graduated from Iowa State University. Catherine Cahill, Pine City, Minnesota, graduated from University of Minnesota, Twin Cities. Janai Calverley, Esco, Minnesota, graduated from University of Minnesota, Twin Cities. Rebecca Casper, Apple Valley, Minnesota, graduated from College of St. Benedict, St. John's University. Megan Chow, Blaine, Minnesota, graduated from University of Minnesota, Twin Cities. Chu, Calgary, Canada, graduated from University of Calgary. Zane Clark, Minneapolis, Minnesota, graduated from Carroll College, Helena. Zachary Cook, Burnsville, Minnesota, graduated from St. Olaf College. Eva Council, Minneapolis, Minnesota, graduated from University of Wisconsin, Oshkosh. Kiana Cullinan, Clear Lake, Iowa, graduated from University of Northern Iowa. Kishore Damodaran, sorry guys, Medomedi, Minnesota, Case Western Reserve University. Got there. Matamidi. Ann Durbatine, St. Paul, Minnesota, Northwestern University. Dylan Delaney, St. Ignatius, Montana, graduated from Montana Tech of the University of Montana. Anna Deerkin, Woodbury, Minnesota, graduated from University of Wisconsin-Madison. Grant Dye, Anchorage, Alaska, graduated from Bethel University. Carol Ellens, Parker, Arizona, graduated from Charleston Southern University. Casey Flowers, Ellery, Ohio, graduated from Ohio State University. Hannah Forlighty, Shoreville, Minnesota, graduated from St. Olaf College. Rebecca Friends, Mendota Heights, Minnesota, graduated from University of Wisconsin-Madison. Caitlin Firot, South Bend, Indiana, graduated from University of Notre Dame. Andrew Glover, Inver Grove Heights, Minnesota, graduated from United States Air Force Academy. Dylan Goolsby, South St. Paul, Minnesota, graduated from University of Minnesota Twin Cities. Trevor Grangenet, Alexandria, Minnesota, Concordia College, Moorhead. Jesse Granz, South Bend, Indiana, graduated from Indiana University, Bloomington. Tanner Gustafson, Carlos, Minnesota, graduated from North Dakota State University. Connor Hansen, Elm Grove, Wisconsin, graduated from University of Minnesota Twin Cities. Nathan Hansen, Stillwater, Minnesota, graduated from Gustavus Adolphus College. Riley Hansen, Nevis, Minnesota, graduated from Concordia University, St. Paul. John Hosman, Evansville, Minnesota, graduated from University of Minnesota, Morris. Teresa Heck, Falcon Heights, Minnesota, graduated from University of Minnesota, Duluth. Thomas Hodge, Duluth, Minnesota, graduated from St. Olaf College. Jordan Holmgren, Wilmer, Minnesota, graduated from North Dakota State University. Waylon Hunter, Mankato, Minnesota, graduated from Minnesota State University, Mankato. Abigail Iverson, Nishwa, Minnesota, graduated from University of Minnesota, Twin Cities. Sanaz Jabari, Tehran, Iran, graduated from University of Minnesota, Twin Cities. Tanner Jackson, Cannon Falls, Minnesota, graduated from University of Minnesota, Duluth. Shruti Jagnathan, Maple Grove, Minnesota, graduated from St. Cloud University. Hanbit Young, British Columbia, Canada, graduated from University of California, Berkeley. Brandon Carrolls, Pearl, Minnesota, University of Minnesota, Morris, and also did graduate training at University of South Dakota, Vermillion. Andrew Kowalski, Valley City, North Dakota, graduated from University of Sioux Falls. Craig Killian, Lake Elmo, Minnesota, graduated from University of Arizona. Benjamin Kaur, Lakeville, Minnesota, graduated from St. John's University. Brian Labatt, Detroit Lakes, Minnesota, graduated from University of North Dakota. Danielle Lang, Rapid City, South Dakota, graduated from University of Mary. Michael Lee, Los Angeles, California, graduated from University of California, Los Angeles. Roy Lee, Skokie, Illinois, graduated from University of Illinois, Urbana, Champaign. Hanjao Lim, Seoul, South Korea, St. Cloud State University. Taiying Loval, Ancona, Wisconsin, graduated from University of Minnesota Twin Cities, and also did graduate work at Iowa State University. Caitlin Lunacek, Rogers, Minnesota, graduated from Bethel University. Christopher Moss, Prior Lake, Minnesota, graduated from University of Minnesota, Twin Cities. Ryan McCullum, Bagley, Minnesota, graduated from North Dakota State University. Austin McCullough, Detroit Lakes, Minnesota, graduated from North Dakota State University. Rachel Meyer, Eagan, Minnesota, graduated from University of Minnesota, Twin Cities. Shay Mikowski, Sauk Center, Minnesota, University of Minnesota, Duluth. Taylor Michelson, Mantorville, Minnesota, graduated from University of Minnesota, Twin Cities. Dominic Milano, Bridgman, Michigan, graduated from Michigan State University, East Lansing. Hannah Morgan, Sodana, Alaska, graduated from University of Montana, Missoula. Sarah Monroe, Roland, North Dakota, graduated from University of North Dakota. Lewis Mercer, Stillwater, Minnesota, graduated from University of Wisconsin, River Falls. Jeffrey Ng, Houston, Texas, graduated from University of Houston, University Park. Daniel Nicholson, Green Bay, Wisconsin, graduated from University of St. Thomas, Minnesota. Jordan Pellegrom, Eagan, Minnesota, graduated from St. Olaf College. Scott Perkins, Eagan, Minnesota, graduated from St. Olaf College. Heidi Petzo, LeSueur, Minnesota, graduated from Minnesota State University, Mankato. Cole Rachowski, Park River, North Dakota, graduated from North Dakota State University. Anna Reister, Rochester, Minnesota, graduated from University of Minnesota, Twin Cities. Sean Roahan, Helena, Montana, graduated from Montana State University, Bozeman. Allison Roladelli, Minnetonka, Minnesota, graduated from University of Minnesota, Twin Cities. Richard Reuter, Olathe, Kansas, graduated from Colorado State University, Fort Collins. Luke Saylor, Pearl, Minnesota, graduated from University of North Dakota. Tracy Sanderson, Sault Ste. Marie, Michigan, graduated from Michigan State University, East Lansing. Anton Sauer, Brainerd, Minnesota, University of Minnesota, Duluth. Jack Sawyer, Brainerd, Minnesota, University of Minnesota, Duluth. Trey Savage, Rapid City, South Dakota School of Mines and Technology, and also did South Dakota School of Mines and Technology. Sorry, it's just double printed. Michael Shockey, Petersburg, Alaska, University of Alaska, Southeast Jonu. Haley Shalai, Moundsville, Minnesota, University of Minnesota, Twin Cities. Jacob Schroeder, Ramsey, Minnesota, graduated from University of Minnesota, Twin Cities. Alexandra Shutter, St. Paul, Minnesota, George Washington University. Ryan Seehafer, Long Lake, Minnesota, Bethel University. Igor Shiloh, Bismarck, North Dakota, graduated from University of North Dakota. Nicholas Sorensen, Chanhassen, Minnesota, graduated from University of Wisconsin-Madison. Jen Stempel, Excelsior, Minnesota, University of Northwestern St. Paul. Brooklyn Stevens, Lake Forest, Illinois, University of Missouri. Nicholas Stofiz, Minnetonka, Minnesota, graduated from University of Minnesota, Twin Cities. Ryan Tordovich, Lakeville, Minnesota, graduated from University of Minnesota, Duluth. V. Trong, Saigon, Vietnam, graduated from University of Minnesota, Twin Cities. James Vang, Minneapolis, Minnesota, graduated from University of Minnesota, Twin Cities. David Vaughn, Inver Grove Heights, Minnesota, graduated from Concordia College, Moorhead. Mackenzie Verbote, Bemidji, Minnesota, graduated from North Dakota State University. Jordan Vinger, Lewiston, Montana, graduated from University of North Dakota. Hannah Weber, Golden Valley, Minnesota, graduated from Concordia College, Moorhead. Charles Wiener, Richmond, Minnesota, graduated from St. John's University. Emily Wick, Lakeville, Minnesota, graduated from Luther College. Nathan Wong, Medina, Minnesota, graduated from University of Wisconsin-Madison. Jonathan Yontumbian, Los Angeles, California, graduated from University of California, Los Angeles. Ahmed Yosef, St. Paul, Minnesota, graduated from University of Minnesota, Twin Cities. Lauren Zedema, Sterling, Illinois, graduated from North Illinois University. Let's give them all a big round of applause.
Would the Doctor of Dental Surgery class of the class of 2021 stand and recite the oath for new dentists as printed in the program with me? In the tradition of Hippocrates and the men and women through the ages who have dedicated their lives to the art and science of medicine and dentistry, I make the following pledge. The respect and dignity of patients and the confidential nature of our relationship are foremost in our service to them. I acknowledge my limitations and need for continued education. I will seek the knowledge and inspiration of my colleagues, friends, and patients. My work shall be dedicated to improving the quality of life for those who seek my assistance. I will honor the wishes and needs of the patient and will always communicate treatment plans in the best interests of the patient. I will do no harm. I will strive always to improve the practice of dentistry to provide a level of care that is ethical, moral, and just. I expect the same standards from my colleagues and will not tolerate their indifference, greed, or unethical behavior. My profession is an honored one. I will not violate the trust society has placed in me by allowing race, religion, sexual orientation, gender, or social standings to affect my judgment or ability to take care of my patient. I will be humble. I will consider the tools of my profession to be knowledge, skill, compassion, and patience. I will share these tools freely with my colleagues and patients alike. I shall do my utmost to provide the vulnerable members of society the care and attention they need to assure their health, dignity, and protection. I see all human life as sacred. In the presence of my teachers, my family, and my friends, I make these promises solemnly and freely. With this oath, I willingly assume the rewards and responsibilities of a dentist. Welcome to all of you.
And now it is my pleasure to introduce our keynote speaker for today. Ms. Megan O'Connell is a 2010 School of Dentistry alumna. She earned a Bachelor of Science in Dental Hygiene, graduated with honors, and earned several leadership awards. Following graduation, she has been practicing dental hygiene in a few small private practices in the southwest suburbs of Minneapolis. Megan enjoys volunteering in her community and marvels at the many advancements dentistry has to offer. She is currently in the process of completing a Master of Science degree in the dental hygiene education. Megan has served on the University of Minnesota Division of Dental Hygiene Advisory Board since 2010. She is both a member and the MSDH class representative for the American Dental Education Association and is a member of the American Dental Hygiene Association. Please welcome Ms. O'Connell.
Hi, good afternoon, and thank you for having me today. What an honor to be here. Congratulations to each of you on receiving your white coat. This moment brings back some fairly recent memories for me. I was sitting in those very chairs just shy of a decade ago, and let me tell you, a lot can happen in 9 years. It feels just like yesterday, and I can still remember how nervous I felt entering into a professional program and future career that I didn't know very much about. I only knew that I wanted to help others. I like going to the dentist for checkups, and I was very fond of a nice smile. I also was not aware that I would soon learn an entirely new language. Words like diastema, lateral incisor, and cusp of carabelli will soon become part of your vocabulary. At first, you may think some or all of these new words sound like a foreign language, but eventually, even your significant other, family, and friends will become familiar with these terms. You can just ask my husband. So in 2008, I was a first-year dental hygiene student. As my classmates would still tell you, I was eager and excited to say the least. I had bought a brand new School of Dentistry t-shirt, hot off the press from the Kaufman bookstore on campus, to wear on my first day of orientation. While I'm still embarrassed looking back at my eagerness, I can't say that my enthusiasm has waned over the years, as I still sport a pair of molar earrings and smiley teeth socks to my work in private practice every day. For me, sharing my optimism and zest for dentistry on a daily basis is important. I am proud of my profession, and if I can share that joy and make at least one patient or colleague smile, then my accessories have served their purpose. In 2015, to take my love for teeth a step further, I decided to pursue my Master's of Science in Dental Hygiene education here at the School of Dentistry, where I am currently in my last semester. So I think that this may set me apart from previous white coat ceremony speakers in that I am not very far removed from where you are today, as I am again a student here at the School of Dentistry. For that reason, let me try to give you a few words of advice to set you on your way. First, from the outset, embrace the opportunity to work and collaborate with one another. As you sit here today, pick a fellow dental therapy, and hygiene student and look in his or her direction. This person may be your future colleague, business partner, employer, or employee. This opportunity you have as a student in clinic the next 2 to 4 years is a glimpse into your future. Work together in managing your patient's care, treatment planning, and completing your graduation requirements. In your futures as clinicians in private practice, you may need to refer a patient to another practice, seek advice from your employer, or ask your colleague to assist you clinically. So as you work alongside one another now, embrace these learning experiences paired with the knowledge of the faculty and your fellow students, and you will learn more than you could have ever expected. Next, utilize your instructors. They are brilliant, encouraging, wonderful people, and are literally here to help you succeed. As a dental hygiene student, my most impactful instructors were the ones that shared their love and excitement for patient care with me. As experienced clinicians, these instructors know a plethora of knowledge because they had seen and done it all. Their clinical tips and tricks, horror stories, and professional accomplishments provided me with many lessons that I am still benefiting from today. I am forever grateful for their compassion, willingness to teach, and patience, as they were instrumental to my development as a dental hygienist. After graduation, I have even still kept in contact, and they have become great resources and friends. From here on, network within the School of Dentistry. Volunteer and participate in your student association and groups. Connecting with other students and dental professional groups will afford you many opportunities to meet leaders within the dental community. I served as class president, was on student council, was part of the alumni board, and participated in my Student American Dental Hygiene Association group while on campus. It all provided good bonding experiences that connected me with fellow classmates, other School of Dentistry students and faculty, as well as alumni. In truth, our alumni are great resources and have very helpful experiences to share. They also may be your future employer or associate, so it is always a good idea to start connecting and sharing your wonderful qualities with them sooner rather than later. Next, and above all, connect with your patients and care for them as if they were part of your family. After 2 years or more of seeing some of them for specific graduation requirements, which can mean once every 3 months or possibly 4 or more visits to finish a large case, you will become very familiar with one another. I can remember receiving hugs, cards, and tearful goodbyes when I was finished. So if you share with your patients how much you value them and their oral health, they will be people that you can depend on and will make your educational experience that much greater. Also, please never forget the reason why you are here today and what these white coats represent. The white coats symbolize your ethical and professional obligations as healthcare professionals. Not everyone is eligible or willing to sacrifice so much of themselves, but if you are, you will be rewarded with a fulfilling career. Next, and I think this is most important, connect with your classmates. Mine are my best friends. We have lived together post-graduation, in some cases worked together, and even been in each other's weddings. We go on vacations together, frequently see one another, and our children now have play dates together. The bonds you're going to create over the next 2 to 4 years have the potential to be some of the best friendships you'll ever have. Making the most of this educational experience 9 years ago has provided me with some of the best memories of my life. My friends and I still reminisce about how much fun we had, but the best part is that we continue to make memories all these years later. Finally, as most people know, me can attest, I love my chosen profession and career path. I'm very proud of my educational background and clinical experience because it's the best. Throughout the years, I have gained knowledge in a wide variety of dental techniques and concepts. However, I did not realize what kind of ongoing learning opportunities were available until I started working full-time in private practice. Since graduating in 2010, I've been trained in the use of diode lasers, assessments for Botox and sleep apnea, and intravenous sedation for dental procedures, just to name a few. Therefore, my words for you guys for post-graduation are, don't just clean teeth and drill and fill. Be a go-getter. Continue to learn and challenge yourselves. Don't just sit idly by. Volunteer. Take on extra responsibilities within your practice. Join study clubs, join committees, perform research, and engage yourself. So dental students, dental therapy students, and dental hygiene students, enjoy your experience here. Make each day better than the one before. Collaborate, connect with faculty, alumni, and your fellow students, and truly care for your patients as if they were your family, because they will learn to trust you and will stick by your side no matter what. Be eager and excited because you are about to begin a challenging and awesome journey towards your future selves. I trust that you all are going to be incredible dental professionals. Congratulations again, and thank you.
At this time, I would like to thank our speakers for their participation And to all the families, friends, and guests and faculty who have attended today's wonderful celebration ceremony, I now ask our students to please follow Allie and Julia, who are going to be over the door to my left, your right. They will lead you over to Pillsbury Hall, where we'll be taking class pictures. So you just want to follow their lead. Guests, please remain seated until the students have left the auditorium. Then we will ask you to join us out in the lobby for a reception. And we just again thank you for coming and celebrating with your sons and your daughters or your husbands or your wives on this very memorable occasion of our students joining the profession. Thank you and have a great weekend.